courage drives Patricia Cruz. The mother of two always puts others first, even before her own health, until her family encouraged her to ask a doctor about her recurring urinary tract infections.
I got a sharp pain on my right side, really sharp, and it lasted for about an hour. And I threw up from the pain.
The UTIs were not caused by anything from her diet, but rather two large tumors on each of her kidneys. Dr. Benjamin Lee is chief of urology at Banner University Medical Center, Tucson. He remembers first seeing Cruz's tumors.
So this is the entire cancer here. The one on the right was about the size of a football. The one on the left was about the size of a grapefruit.
I was very shocked and very scared.
She was told she'd have to have surgery on both kidneys, likely have to go on to permanent renal failure, have to progress onto dialysis. And I thought to myself, we can help her.
I was just talking to the nurse practitioner that saw me at the hospital initially, and she just opened my eyes and said, you know, this is not the end.
Instead, it was the beginning of an innovative approach to treatment by Dr. Lee.
One of the innovative factors that was performed at the Arizona Cancer Center and here at Banner University Medical Center, Tucson, was to downsize and shrink the tumor using tyrosine kinase inhibitors prior to robotic surgery.
It made me feel so at ease, and I was just so impressed of all the advancements.
The chemotherapy made the tumors easier to remove. Rather than removing them through a large incision on her lower abdomen, Dr. Lee used a robotic procedure like this one, which only required a cut the size of a dime.
With the big cut, it can oftentimes be a 4 to 5 month recovery. With robotic and laparoscopic surgery, it's more on the order of 2 to 3 weeks.
Dr. Lee was able to remove the tumors and save at least half of each kidney. And in turn, Cruz regained full function of her kidneys. No dialysis, no transplant needed. And best of all, Cruz says, she was virtually pain-free.
I did not feel any pain after the surgeries.
Because the incisions are smaller, the amount of pain is less. Because the amount of pain is less, the amount of pain medication required is less, and the recovery time is quicker.
Cruz was back to work within a few weeks, and back to being the mom she's used to being for her two daughters.
My children have always been so strong and by my side, always. And I just feel very blessed and very happy to be alive.
Happy, Dr. Lee tried something innovative that restored and improved her quality of life. For Banner Health, I'm Jeff Stensland.